Hello, and thank you so much for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest today is Frankie Ann Holmes, MD. She's a board certified in internal medicine and also in medical oncology, and her professional career has involved the treatment and research for the cure of breast cancer. She's joining us here today on the program to talk about the latest in breast cancer research and the recently approved early stage treatment, NERLYNX. Welcome to Health Professional Radio, Dr. Holmes.
Thank you so much. I'm delighted to be here.
Great. Now, breast cancer, we're all familiar with breast cancer. Many of us have been touched in one way or another. When it comes to the prevalence of breast cancer, what are the numbers telling us?
Well, it's about 1 in 12 in the past, and it's about 1 in 8 now, about a 12% incidence of breast cancer if you live to be age 90. Certainly, there are factors that can influence that in terms of lifestyle, maintaining weight, use of hormonal therapies, alcohol, exercise, and there is an influence of breast density, which we can measure on mammograms. And one very important aspect that we have learned, in which Angelina Jolie's situation has helped us, is in understanding the genetic basis of breast cancer, which is not large, about 10%, but still is a predictable risk factor that we can address.
Is this genetic marker present no matter what age a woman is? I mean, if it's genetic, it doesn't matter what the age is. You can still detect it, right?
That's right. So the difference between a genetic marker and a marker that happens only in the tumor, which is called a somatic marker, think of a veteran who goes to Afghanistan and loses his leg. If he comes back and has a baby, will his baby have 2 legs? Yes, because that was something that happened after, as opposed to someone who has red hair. You know, he has that gene, and he can pass it on to his, or she has that gene, can pass it on to her children as well, and that's present in every cell in your body. This gene for breast cancer that Angelina Jolie had, the BRCA1 gene, and there's a companion gene, BRCA2, is present in every cell in the body, but it seems to have its most active cancer-causing problem in breast cancer and then ovaries.
Is the number increasing? I mean, is this getting worse, or has it leveled out and we're just trying to deal with it, hopefully?
We're detecting a lot more breast cancers, but we're also detecting a lot less aggressive breast cancers. And we've seen great improvement in terms of our outcomes with breast cancer based on early detection and much improved treatments.
You know, when I was growing up, self-exams were pretty much the buzzword when it came to early detection. Are self-exams still a normal part of early detection, or are ladies now going to the doctor and dealing with their physicians rather than trying to determine that there's a problem on their own?
Boy, that is a terrific question. Everybody was told to do their breast self-exams. And there was a marvelous study that was done in China where there are large communities of women who work in these textile factories. And it's like in the old days in the U.S. when there were the manufacturing towns or the coal mining towns. Everybody's life revolved around that single industry. So in these large areas that are separated from other areas, medical care is provided. And a very well-done study was done in which they took women in these communities, and half of them, they had an intensive program of breast self-exam. I mean, every month they had reviews of it, and all of the health care in that textile factory was provided, and at every moment possible that patients had an interaction, they had reviews of it. It was really well done. And then the other, it was the standard. And they found out that those who were doing breast self-exam and doing it well had a whole bunch more lumps that turned out not to be anything, and the overall incidence of true breast cancer wasn't any different. So we discovered that the breast is really not like a Ziploc baggie of vanilla pudding. The breast is often much more like a Ziploc baggie full of granola. It tends to be lumpy, fibrous, nodular, and changes during the menstrual cycle. So a woman really doesn't have the ability often to discriminate that sort of thing. So breast awareness, obviously, if the breast looks larger, the nipple is pulled in, there's dimpling, there's redness. But having that annual mammogram is what has been so helpful. And now we have 3D or tomo mammograms that instead of taking a picture like a front and a side view, now it makes the breast into a book. It has multiple little pages, slices as it slices through, and we can actually look at each section in the breast. We also have ultrasound, which can help in the situation where breasts are very dense. So some women have mammograms that are basically all white. Normally fat tissue is black and breast tissue is a whitish gray color. But if there's a lot of fibrocystic change and scar, then we have almost a white breast. Breast cancers generally appear as whitishness, calcifications, or distortions, or a mass. And if you're looking for something that looks like a snowball in a snowstorm, it's hard to see if you have a white breast. So ultrasound was shown to be very helpful. And then, of course, we have MRI. These are the ways that we detect early breast cancer.
Now, I understand that there's a recently FDA-approved treatment for early-stage breast cancer. Talk about the type of early-stage breast cancer that this newest treatment addresses.
Yes, this is a really exciting thing because this is a very different treatment. So about 1 in 5 to 1 in 4 breast cancers have a protein on the surface of the cell that is present in many-fold higher concentrations than normal, and that protein is called HER2. A normal cell has about 20,000 of these. They're like solar panels on the surface of the cell that allow communication from the outside, sending signals to the inside. Patients who have HER2 positive or HER2 amplified breast cancer have 2 million to 2.5 million of these receptors.
Wow.
So the cell is just getting all of this input all the time, grow, divide, grow, divide. And so that causes a cancer that is addicted to this HER2. And Dr. Slayman in California was the one who discovered this and also developed the treatment that is an antibody that on the outside you can think of as a black wet blanket, whap, that goes on that solar panel, and shuts that cell down. So treatments were developed in conjunction with chemotherapy, showing a dramatic improvement in survival. If chemotherapy was given with this medicine, trastuzumab, Herceptin is the trade name, to prevent recurrence and to lengthen lives. However, it was found that at 10 years in those studies, still there were about 15% of patients whose tumors came back. And why was that? Because this tumor is addicted to the HER2. Well, the biology, the understanding of how that worked unfolded that HER2 has a part on the outside of the cell, and think of the cell as a sunny-side-up egg. The yolk, the nucleus is where the DNA is. That's the blueprint, the brains of the cell. And then the white is where all the machinery of the cell that does what the blueprint sends out. And then there's a rim, like on a piece of bologna, that little rim on the outside there. So the HER2 molecule has a part that sticks out to interact with the cell, goes through the cell membrane at that bologna liner, and then there's a part inside the cell that sends the signal to grow, divide, grow, divide. So Herceptin works on the outside. Well, then a new class of drugs was developed that works on the inside, and that's what neratinib is. It works on the inside. And not only does it work on HER2, it works on HER1 and HER4. The trastuzumab or Herceptin, it latches onto the cell, but then the cell sucks it in and breaks it up, and it goes away. But neratinib, when it attaches to HER2, HER1, and HER4, it never lets go. It has a death grip on that receptor, and so that receptor is turned off. Its lights are out. So this very interesting drug was tested in patients who had received the standard treatment for breast cancer. So they got their chemotherapy with the trastuzumab, and it was shown that if you take the trastuzumab for one total year, chemotherapy is usually only 3 to 6 months. You start it with the chemotherapy, and then when the chemotherapy finishes, you keep taking it. The trastuzumab is an injection. It's kind of like getting a gamma globulin shot, except to get it IV. It doesn't have many side effects, except it can be hard on the heart. So you have to make sure your heart is in good shape, and you have checks every 3 months of the heart function. So this trial said, well, look, how do we get those 15% of patients? Well, let's try neratinib because it works a different way. It gets inside the cell. So in this trial, there were almost 3,000 patients, and half of the patients had the standard, which is you finish your trastuzumab, Herceptin, and you're done. Or you take your anti-hormone therapy if your tumor is hormone positive. And the other half would get this pill. And all clinical trials have developed a powerful method called randomization. That is, half of the patients get the standard treatment and half get the new treatment. And the most powerful form of this is what is called double-blinded. That is, neither the doctor knows nor the patient knows. So that way, every single side effect that the patient experiences is recorded, and nobody knows, gee, is this the drug or not? And that gives us a very accurate interpretation of what is the effect of the drug and not what is the bias of the investigator or the doctor.
The brand name of this recently approved drug, this recently approved treatment, what is the brand name?
NERLYNX.
NERLYNX.
NERLYNX. Mr. Alan Auerbach, who is the person who rescued this drug from dying, apparently loves cats. And he has another company called Cougar. This company is Puma. So he's a very interesting man, and he saved this drug for our patients.
Now, where can we go online and get some more information about NERLYNX and the Texas Oncology and the U.S. Oncology Network Breast Cancer Research Committee? Where can we go online and get some more information?
usoncology.com is a good way to get in touch with that. Of course, the FDA, which is always a good source, fda.gov, and you can get the package insert for neratinib, NERLYNX, and the last page of package inserts always have a patient information page. And, of course, you can go to NERLYNX.com.
Dr. Holmes, Frankie Ann Holmes, oncologist with Texas Oncology and a member of the U.S. Oncology Network Breast Cancer Research Committee. It's been a pleasure talking with you. Thank you so much for this information, and thank you so much for coming in, Doctor.
It is my pleasure to talk about research. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.